Hi, I'm Dr. Lorenzato, and I'm going to talk about seasonal allergies and your allergic immune response. This is video 1 of 2. This is sort of an elementary introductory video. When a person is exposed to a virus or bacterial infection, their innate immune response is activated. This includes the B cells producing immunoglobulin E's and a large amount of these. The result of that, along with the effect of complement, which is the release of 21 proteins into the bloodstream facilitating the attack of the immune system on foreign cells, your body produces a lot of secretions and has boggy membranes. It sort of creates a state of misery. So a nice way for me to diagnose allergies is to ask a person, how miserable are you? And can you add a column of numbers? Because the response for an immune fight, when your body's fighting these foreign particles, causes so many secretions to be released and so many molecules that it's almost hard to be in your body. It's like there's a basketball in your head. So what can you do about it? Well, if you have seasonal allergic allergies, we'll get to that point. First, the first time you're exposed to a virus at the beginning of the big seasonal bloom in the spring, or when there's a die-off of biomass in the fall, if you're exposed to a virus and then after 2 or 3 days of letting your innate immune response eradicate that virus, you take steroid nasal sprays from 2 to 4 days, you can benefit tremendously by lowering the total amount of white cells engaged in this immune response and quelling that fight. This can create a situation where you don't have to deal with so much allergies as otherwise you would. Nonetheless, you probably will continue with a non-sedating antihistamine for several weeks. We'll get into that. So, assuming that you were unfortunate, had a viral or bacterial infection, and there was a big bloom, you've then developed seasonal allergies. How do you manage them? Well, several common ways. If you can manage them simply with a non-sedating antihistamine, and now there are 3 over the market, there's loratadine, cetirizine, and phenylphexidine. That should be sufficient. Also stay well hydrated. Those antihistamines help some. If that's not enough, occasionally you're very congested. You may want to take a decongestant antihistamine combination. There are many antihistamines. They come in combination with decongestants frequently. They are like diphenhydramine, hydroxyzine. There's one that's more sedating. It is doxylamine, as well as there's chlorpheniramine and brompheniramine, some of my favorites. An antihistamine combined with a decongestant, drying the membranes out tremendously, gives you breathing time with your sinuses less pressurized because the ostia, the opening, are now open to let equilibrium with the atmosphere. So we're doing a non-sedative antihistamine, sometimes a decongestant with antihistamine. The third, back to the steroid nasal spray. So fluticasone and mometasone are 2, and there are other steroid nasal sprays that are frequently used to suppress the white cell population. You may do this for 2 or 3 days in a row, stop, repeat as needed. If this fails, then I see patients back frequently and we'll use a medicine Singulair, which is one of the leukotriene inhibitors. There are other leukotriene inhibitors. This has been a short introduction saying, yes, you may have had a virus and now your first exposure to seasonal allergies. They're best treated a little bit more aggressive than people like when I use the word steroid, but it's for only 3 to 5 days generally. Please use a decongestant if you need it temporarily for only 8 hours a day, no more. And you can also view the video on the management of congestion. Thanks. There's a video following this if you want to know a greater depth of understanding about the immune response.